Right, cool. Well, welcome to the Executive Playbook, the show where we go inside the minds of founders, operators, and investors who are building companies that shape the future. I'm your host, Jay Twitty. Today, we're diving into how software companies can stay ahead by better understanding their customers' evolving needs, especially in a world increasingly shaped by artificial intelligence. My guest today is James Bates. He is the founder and CEO of AdviNOW Medical. James has an incredible background that spans engineering leadership at a few companies to now building one of the most exciting companies in AI powered healthcare. At AdviNOW, they are transforming the patient experience by automating the entire clinical journey from intake to diagnosis through intelligent systems. So, James, welcome to the show. Thank you for being here. For listeners who may be new to your work, could you give us a quick intro in your own words?
Yeah, thanks, Jay. I appreciate you having me today. My name is James Bates. I've been in the high technology field for 30 years. The company that I run now is called AdviNOW Medical. We use artificial intelligence and augmented reality to completely automate all clinical and operational aspects of the medical practice. This is what will allow medical practices to stay independent. It allows their profitability to go up over 1,000%. It reduces burnout on doctors and actually allows patients to have faster care, better access to care, and lower costs.
So man, that's really cool. Yeah, long travel. Can you walk us through a little bit of what led you to launch AdviNOW and kind of, step into this mission?
Yeah, before AdviNOW, I ran a billion-dollar business in self-driving vehicle technologies. We made the technologies that gives, Tesla, Google Waymo, Daimler, GM, really 80% of the market that does advanced driver assisted systems, the ability to auto brake or auto steer. We sold that business, and as an officer of the company, it was a good time for me to retire. So I retired and started looking at what else I was going to do in the market, but I had a very strict non-compete. That meant I can do anything I wanted to do as long as it was something that I've never done before, right? And so
Understood.
so with that, I looked at healthcare really because healthcare is pretty broken. Costs are skyrocketing, outcomes are not improving at the rate we would like them to. People in general are not healthy. And I figured there's got to be something we can do. Well, my initial thought was just to buy some medical practices. And so I got with a banker and started looking at medical practices that were on the market. The more I looked at medical practices, the more I was surprised at what difficult businesses they are. In fact, the average net profit of the medical practices that I looked at was only 3%. And the high watermark was 9%. And roughly half of them, once you normalize the P&L and pay the physician a market salary as a W-2 employee, they lost money. So as a financial buyer, you can't buy a business that is that difficult, right? I mean, a lot of businesses, a lot of medical practices, they're just selling to hospital systems or selling to insurance companies or private equity because they can't make it on their own. So I decided to give up, right? I decided I can't buy a medical practice. That's not going to make sense. Well, what I decided to do was actually help a guy who was running a medical practice improve his company. And through that process, I entered the the operational aspect of medical practices. Well, I came from outside the industry and I looked at it and I said, the widget, if you will, that's being created is the medical encounter. The cost of that widget is $100. The value of that widget, according to the insurance company, is $103. So, I mean, if the same if it costs you exactly what you're getting paid, you don't make any money. So the only way to fix this business is to work on the cost aspect of the medical practice. So I started with a Six Sigma cost analysis. And what that means is I took a stopwatch and did a very detailed time and motion study of every single motion inside that medical practice. And I ranked it whether that motion was required by the person doing it, as well as the value on the product that that motion created. When I did that, I realized that the physician was spending 70% of their time doing things that had nothing to do with their medical license. In other words, it meant that the physician was only doing the things that got him paid for 1/3 of his day. 2/3 of his day would be like him on the assembly line in the factory. Well, you're never going to make money of the bottleneck in your business for revenue, which is the physician, and the person who gets paid the most is sitting on the assembly line for 2/3 of their day doing a job that anybody else can do. So AdviNOW Medical, what we did is we looked at what it would take to automate the activities that the doctor was doing. Well, the doctor is the one stuck doing a lot of these tasks because they have diagnostic and treatment understanding, which they learn in medical school. But they also have insurance company understanding and liability understanding. They know what the lawyers want in the medical record so they don't get sued. They know what the insurance companies want in the medical record so it actually gets paid. At the same time, they're diagnosing and treating the patient. Well, AdviNOW developed an artificial intelligence that mimics the physician's brain. We mimic not only the diagnostic and treatment, but also the liability and payer or insurance information. And we can predict every single question a doctor is going to ask a patient before that patient ever makes it to the clinic. Through this process, we're able to see the metrics of the clinic just go through the roof.
That's really cool, man. That's a great service to have. I'm sure your clients are very pleased with the, to have that type of technology to be able to implement now for sure. So what does your day-to-day look like as a CEO leading an AI company in such a high stakes space like healthcare?
Well, in any startup company, the CEO spends a lot of his time with investors. So unfortunately, that's no different for me. I spend a lot of my time babysitting people who write us checks to create this vision. And then the rest is really making sure the product matches exactly the expectations of our clients and making sure our clients are happy. So ultimately, if you don't have happy clients and they're not happy to pay you, something's going on, right? Your business is not going to be successful long term.
That's really cool, man. With me being an AI, I've been, of course, trying to convince people to implement different services into their business as well. A lot of founders worry about trust when introducing AI into their user experience. So, how is AdviNOW building confidence with users, both with patients and the clinicians?
Well, I mean, ultimately, AdviNOW is not a diagnostic tool. We're not a treatment tool. All we do is collect all the information for the doctor and allow the doctor to review it. So the doctor then makes their own decision. So from a clinician standpoint, what they need, the doctors need to see is that the workflow inside the clinic, the questions that are being asked are everything that a doctor would do. And so when they use the system and they see that, that's how we can deliver those type of returns. Now, at the same time, that's how we get the clinicians to buy in. On the patient side, well, the patients, they don't even know they're using an AI. Most of the time, the doctors, the patients they get a text message from their clinic. They'll click on it. They'll put in their driver's license, their insurance information, maybe schedule an appointment. They do all of this on their phones today. And usually there's like the pre-visit questionnaires they always want you to answer before you arrive at the clinic. All of that happens up front. And so to them, it's the same as it's always been. What the difference is usually the patients are answering the same questions every time. Does your grandma have diabetes, right? Who had cancer? Did you have cancer? Do you feel sick? These standard questions that are quite frankly a waste of the patient's time and a waste of the doctor's time because nobody looks at them. They need to collect them for insurance reasons. But AdviNOW reviews the electronic medical record and only asks questions that are important for the patient to answer. And that's what allows us to be successful.
That's awesome. That's awesome. So, I guess, another, I guess, concern sometimes is just the, the human element of that customer journey. Do you have any maybe advice for software leaders trying to balance, automation with that human element?
Well, ultimately, humans want to engage with humans. They don't want to engage with a bot. Now, AdviNOW is just replacing questions that don't matter with questions that matter. So to the patient, the experience is exactly the same. The difference is if once the patient sees the doctor, the doctor's now looking at them in the eyes instead of asking them 20 questions with their head buried in the computer.
That's cool.
And so what it's all about is, can you enhance the human to human interaction with your business? Because today, guaranteed, there's some detractors from it, just like the doctor is distracted by his head buried in the computer. If it's a lawyer, the lawyer has the same distractions. You can go through each business that is adopting AI today, and you can see some pretty dramatic changes. So with that in mind, you end up with some pretty interesting opportunities with AI, such that the human interaction part of the business is enhanced rather than being detracted at all.
That makes a lot of sense. Yeah. Get the monotony out the way so you can really focus on, that human to human contact for sure. So let's get into like kind of what AdviNOW, how you guys are doing now. What's something that's been working really well for you guys, either operationally or in terms of product growth?
Yeah, I mean, so from AdviNOW's perspective, because we're so revolutionary inside the practice, we can throw a stick and sign up 20 clinics, right? I mean, that's easy to do. The problem always has been is, how do you onboard a clinic? I love physicians. I work with physicians a lot. Most of my investors are physicians, but physicians are, a unique type of individual. They're always the smartest person in the room, and their way is always the best way to do it. And so if you have a software that's going to convince a doctor to change the way they're doing things, probably it's not going to do well. So what AdviNOW is doing is we're automating our onboarding so we can match exactly what the physician does today. And then we layer on to it compliance management. We layer onto it liability management. We layer onto it the things that really bring value with efficiency. But ultimately, the physician sees their note, right? What they would normally do, and it looks like they wrote it.
That's really cool. Yeah, that's a great service. I'm pretty sure your clients are enjoying that new these new opportunities for sure. So, about the future, where do you see AdviNOW in the next 6 to 12 months?
Well, we are growing quickly. I mean, we'll grow.
Good luck with that, man. Definitely, definitely. If you could wave your wand and remove one bottleneck from your growth plan this quarter, what do you think that would be? Yeah, sure. Yeah, absolutely. So, as far as the entire, AI platform and, the entire AI industry, what are you most excited about in terms of where AI and patient experience intersect over the next few years? I agree. I agree. Definitely, definitely. Well, James, that was really incredibly insightful. You brought a lot of clarity around, how real users are interacting with your software today, how we as builders need to evolve along with them, especially when AI is a part of that product experience. Before we close, where's the best place for listeners to learn more about AdviNOW or connect with you personally? Awesome, man. Well, James, thanks so much for sharing your playbook with us. To our listeners, if this episode sparked an idea or helped you think differently about the customer experience, go ahead and follow the Executive Playbook wherever you get your podcasts. We'll be back next week for more strategies from leaders building what's next. Until then, keep executing with vision.